This is a case of adenomyosis, anterior wall of the uterus. Now we are going to do ultrasound guided percutaneous trans-abdominal microwave ablation. So we are not using laparoscopy here. It's a really minimal invasive ultrasound guided percutaneous trans-abdominal. Now we are going to do microwave ablation of adenomyosis anterior wall of the uterus. Okay. We have seen the direction with the help of a radiologist and gynecologist. So we are inserted into the abdominal. You can see the angulation in plane approach. Okay, in plane approach. Okay, we are entering into the direction. Please. Correct. Okay, we are entering into the abdominal wall. So the safety very important to avoid intestine, bowel injury. Position, you can see the head low position, and you can see now this uterine elevator. You can see uterine elevator is there. Okay. Head low position, uterine elevator. This is a mandatory to keep the uterus up and the bowel is down and head low position. Bowel is away. And we can create, you can see we have poured into, it is called artificial ascites, black shadow. We already given a saline injection of 100 ml to thermal conduction to the other structure. Okay. Now we are going to do microwave ablation. The region is a 4 centimeter. 4 centimeter we have to ablate. Maximum 4 centimeter, 50 watts. We have to ablate 8 minutes. So 50 watts, 4 centimeter, 8 minutes we have to ablate. We are going trans-abdominal approach. Okay. This is the 20 centimeter, 3 mm, 3 centimeter active tube. 50 watts we are delivering. We'll show you. Pass. Ultrasound guided, we are entering into the abdomen in plane approach. Okay. You can see now percutaneous trans-abdominal ultrasound guided. You see this antenna under ultrasound guide reaching the target of the adenomyosis uterus, and under ultrasound we are ablating now. We'll see now. You can see. Needle is clear. Zooming. So we are entering into the anterior wall abdomen. You can see now. Yeah, my needle is enter inside. We are reaching inside anterior wall abdomen. Okay. Now we can see the needle. Yeah. So we reach the anterior wall. Then we are going to ablate.